The Academic Health Collaborative is our way of approaching and developing new strategies to stimulate interdisciplinary and cross-disciplinary research, teaching, and service.
We're going to be able to take these disciplines that really should be interacting with each other: nutrition, kinesiology, pharmacy,
psychology, statistics,
communicative disorders, exercise science and kinesiology, health studies, food science, human development and family, and physical therapy.
This even involves computer science and biomedical engineering and medical devices, the discovery of new pharmaceuticals.
We're also pulling in individual faculty that are not officially in the collaborative who will bring expertise in business, big data and nursing, economics and health finance, political science and health policy.
And we will better coordinate the activities of not only the researchers but the clinicians in those departments.
And the idea of the Health Collaborative is to bring them together in new ways to foster the kind of collaboration and joint research and teaching efforts that we think will help prepare the students and help derive the new knowledge that we'll need in the coming years ahead.
We are really welcoming the biggest transformation in higher education related to the biggest transformation in healthcare.
The URI Health Collaborative means removing silos and creating synergies, where the whole is going to be greater than the sum of its parts.
We really need to be thinking before disease happens. How can we prevent it versus treat it? Because that's the only way we're going to really change the health of our nation.
I think the benefit to students is an opportunity to learn the skills of collaborating and working in teams, interprofessional teams, which currently is not available at most universities.
Most physicians would tell you today it's really a team sport. And the doctor is still very important in terms of that team, but it is a team, and it's a multidisciplinary team, and it's a collaborative team.
By letting us work with this healthcare collaborative, now as students, we're going to learn how to be that communication between the patient and the pharmacist and the doctor and the physical therapist.
Working with such things as nurses and biologists and all that will help us get a better feeling of how the other parts of the science fields do what they do.
It's absolutely clear to me that society is moving in a new direction with regard to health and healthcare. We have old models in place, and the University of Rhode Island is in a position to lead a whole new collaborative model.
When we talk about collaboration, we talked in terms of within the university and collaborating with cross disciplines, but really healthcare reform really requires collaboration across institutions, across partnerships.
I think the outside partners are going to be very important to help move this forward.
One of the things that we're very keen to do is grow our collaborative work with the healthcare systems here in the state. We have excellent hospitals and healthcare organizations, and we have a long history of working closely with them in a whole variety of ways. That needs to grow, that needs to expand, that needs to deepen in order for us to do what we've set out to do and with regard to contributing to new solutions to the challenges ahead. And we need to prepare our students for that future, not just to participate in it, but to lead in it.
The University of Rhode Island is about to become the leader in education, research, and outreach related to health. We are ahead of the curve, we are carving out new turf, and we are willing and want to partner. We want to really emphasize this word collaboration.
The collaborative is moving us into the next frontier, because although we're known for many, many good things at URI, we think big, and we do. And this is one of the ways that we're thinking big and doing that.
You really want a strong partner in your areas of priority need. So I think for us, URI is that partner.
I think we're uniquely positioned to play a role, a leading role, and a catalytic role in building the new knowledge and the new educational programs that are needed to, I think, face the health-related challenges of the new century.